Hey, it's Dave here, and in this video we're going to talk about, in the context of our irritable bowel syndrome series, what causes small intestinal bacterial overgrowth. So we know that many people who have irritable bowel syndrome have SIBO, but SIBO gets blamed, but the SIBO doesn't just arrive and appear without any reason. There's always an underlying cause or an underlying factor, or maybe even several of those, that dictate whether SIBO develops or not. And so I think we can probably split all of these down into individual videos at some point. So we'll just do a little overview in this particular video. We want to first of all talk about something called the MMC, and that stands for Migrating Motor Complex. And that's a series of muscular contractions in the small intestine that help to squeeze food downwards and through that small intestine during the digestive process. And the migrating motor complex switches on in between meals, and it switches off when you eat. So if you're constantly eating, you might end up with a deficient migrating motor complex. You need to leave decent amounts of time or gaps between your meals to make sure that that migrating motor complex can squeeze through the food that you've eaten at the previous meal and get it all the way through. And if everything gets stuck in there, it provides a breeding ground for the bacteria. That's the concept. The bacteria are not washed out and washed down properly if you have a deficient migrating motor complex. Now you can then ask, well, what causes a deficiency in the migrating motor complex? And we can't cover that in this video, but there may be lots of factors involved with that. There may be other infections that you have. There may be things like emotional stress, and possibly things like underactive thyroid, adrenal problems and what have you as well, that then end up leading to the migrating motor complex issue. So you keep asking why, going backwards. You can go back and find possibly a lot of different reasons for this. The next reason why SIBO might develop is some kind of altered anatomy or some kind of surgical procedure, something that changes the structure of the intestine. And that might be some adhesion, the tissues are adhesed together. It may be strictures where the intestine's twisted a little bit. There could be things like blockages in there, fistula, and even pockets in the tissues where the bacteria are able to kind of sit and hide and multiply as well. A concept called crypt hyperplasia might come into this, where the crypts that are deep down in the tissues of your small intestine become filled up with all kinds of things, parasites, bacteria, pus, and what have you, if there's a lot of inflammation in there. Then we have immunodeficiency. An immunodeficiency is more like a frank immunodeficiency, so not just a mild immunodeficiency, but really low levels of immune function in the mucosa, the mucosal lining of the intestine. That might be genetic. It could be caused by some kind of a disease that you have, autoimmune diseases that affect the tissues in the digestive system, for example, like scleroderma, among other things. Then you have possible problems with the ileocecal valve. And by the way, these three reasons are known to be pretty much true. The migrating motor complex issue seems to be the most common. Altered anatomy and surgery definitely can lead to SIBO, and immunodeficiency can as well. These are kind of known, but when we get down to some of these, we're guessing a little bit. Now, the ileocecal valve is a valve that separates the bottom of the small intestine with the top of the large intestine, if you want to think about it that way. So it separates the small and large intestines. And it's a valve that should allow things through from the small to the large intestine, but stop things from coming back from the large intestine up into the small intestine. So if there's dysfunction there and that valve is staying open, or there's a problem with it, one of the theories is that all the bacteria that are situated in the large intestine migrate backwards or upwards into the small intestine, where they start to have a field day and overgrow. And so while we're supposed to have huge amounts of microbes in the large intestine, we're not supposed to have quite so many in the small intestine. And so that's another theory. And then you can ask, well, why is the ileocecal valve staying open? There could be many reasons for that as well. The next reason is potentially poor levels or low levels of digestive secretions? Are you making enough stomach acid, hydrochloric acid in the stomach? Are you producing enough digestive enzymes and bicarbonate and things in the pancreas and then squirting them into the small intestine when you are needing to digest food? And is your gallbladder squirting out enough bile into the small intestine? All of these factors may be a reason for the overgrowth of bacteria in the small intestine. And then finally, there's another trigger that we know can cause SIBO as well, which is food poisoning. That needs a little bit of additional explanation in its own video, but sometimes you can have a food poisoning with some kind of really nasty bacteria. That creates an immune response that then leads to a catalogue of events that potentially promotes SIBO as well, and we'll cover that, as I say, in a separate video. So it becomes difficult, doesn't it? Because you don't really know which one of these might be affecting you. And I think that's why it's really important to work with somebody to dig into your health history, to try and unravel where the SIBO came from, if you have it. Because the problem with SIBO is oftentimes, not every time, but oftentimes, when you try to treat it with antibiotics or herbs, some kind of antimicrobial agent, you can often feel a lot better, but only for a short period of time. Because if you don't address the underlying reason why it developed in the first place, there's a very high chance that it will come back. And the relapse rate with SIBO after treatment is somewhere between 40 and 60%. So roughly 1 in 2 people, when they treat it, they can spend a lot of money and a lot of time treating this thing, and they go, I feel so much better. And then a month later, boom, the symptoms just come back. Sometimes those symptoms are worse. And the reason is that they've never looked at the underlying reasons why the SIBO developed in the first place. And so I think it's really important to understand those things and to investigate in your own life what caused the problem in your body, because it might not be the same reason that your next door neighbor, your best friend, or your cousin or whoever developed SIBO, right? So I hope you've enjoyed this video. I hope it's been helpful. If you'd like any help with all of these investigations, then there's some links beneath the video window to get in touch. We run case reviews and health history consultations, and we're also able to run a whole range of different testing to help you dig in and figure out what's going on. In the next video, we're going to start to dig into some of these factors in a little bit more detail, particularly the migrating motor complex, and also the food poisoning issue as well, and look at some of the mechanics around why that might lead to SIBO, which then of course leads to this diagnosis of irritable bowel syndrome, which I call intestinal bullshit, because irritable bowel syndrome really doesn't exist. It's a blanket term, if you remember, for all of these different things that we're talking about. And there's always an answer, there's always a way you can get rid of your irritable bowel syndrome if you're willing to investigate these factors. So I hope it's been helpful, and I'll see you on the next one. Take care.